Everybody, I'm Jeffrey Short. Welcome to this Market Scale podcast. As hospitals, pharmacies, and other healthcare-related industries fight the battle against coronavirus, an emphasis has been placed on making sure that waiting rooms aren't crowded and lines aren't long. Joining me to talk about practical solutions for queuing in the healthcare environment is Nick Eason, National Sales Manager for Healthcare at NemoQ. Nick, thanks a lot for joining us today. How are you doing?
I'm doing great. Thanks for having me, Jeff.
Yeah, absolutely. And thanks again for taking your time, your busy day to do this. So Nick, when it comes to the healthcare environment, hospitals, these settings specifically, what are the biggest challenges when it comes to waiting times and managing that? And how are they specific and different from, say, just a restaurant or the DMV?
Sure. For a restaurant or DMV, most people aren't taking off the day from work. They're not exiting school. Everyone wants to spend their time when they take off from work or school as effective as possible. But when emergency strikes and you have to walk into an office or an unplanned event, you want to move quickly. And we battle this by organizing the rest of your day with appointment scheduling, having capabilities. And on the healthcare provider side, we can actually graph out trends like when most people walk in throughout the course of the week. So if that is Monday morning, we know we can schedule less appointments on Monday morning and take more walk-in traffic. And throughout the week, ramp up your appointments so that you are seeing people then and taking less walk-ins. And so definitely we can customize a solution based on trends and things that we see like that, so that we can optimize everyone's day as best as possible.
Definitely, that's really interesting, of course. So can you walk us through more specifically the various solutions that NemoQ does provide in the healthcare space? And again, maybe people aren't familiar with NemoQ as they listen to this. So
Sure.
What are those different solutions that are tailored towards healthcare? And I guess another question on top of that is, every healthcare system, every hospital is different. So I guess how do you walk through that and address those specific challenges?
Absolutely. So there's a couple key factors that we try to take into play, and it's really getting to the bottom of what they need. So how big is their location? How many patients do they see on a given day? Multiple departments in one location. Do we need to transfer somebody from radiology to phlebotomy? All those different things come into aspects, but we definitely have a couple different things that we try to do. We have a greeter functionality, which you can meet someone right at the door, get all their information, and so it's quick and easy. We do have standalone kiosks where the customer or patient can do that themselves. We have what's called Wait Anywhere, with a mobile check-in process where you can actually be on your couch at home, check into the queue, walk in later, so you're right at the top of the queue. Appointment scheduling is something else that we lean on heavily, especially in this environment that we're in, where you can make an appointment for several days out. So a lot of those things come into play, but we definitely try to have a custom solution for every individual healthcare facility. That way they can get something that works specifically for their needs.
HIPAA laws are obviously something that you have to be aware of anytime you're dealing with the healthcare space, right? So does that add a layer of complexity that NemoQ has to keep in mind during this environment or during an installation in a hospital setting, as opposed to a restaurant or the DMV where those concerns aren't as present?
Absolutely. We want to keep everyone as comfortable as possible. For us, it really comes down to gathering the right information and how we present it appropriately. So, for instance, the easiest way is for a patient to check in and they receive a ticket, and that ticket has, let's say, ticket number A123. And so that ticket number will be presented on the TVs, announced over the loudspeakers. So we're actually not gathering that information of your name, first name, last name. We don't want to do anything like that. Another way we can do it is actually ticket lists, where a customer doesn't have a ticket in their hand, but we can gather their phone number, present the last four digits of their phone number, which is usually unique to them, and we can actually put that on the TV monitors or announce it over the loudspeakers. We can also, with the ticket list option, gather their phone number and send an SMS message to that patient. So when it is their turn, they get a buzz from their cell phone and they walk right up into the greeter there.
Wow. And, you brought up some technological points here. I wanted to ask basically, how important of a role has technology played in the ability to queue more effectively, to organize these sort of waiting rooms, and keeping people safe, really?
Sure, absolutely. So for us, technology always plays a big part. We definitely try to be on the cusp of the new technology coming out as it's always changing. So we definitely have mobile friendly web applications out there. So you can use it from your cell phone, tablet, or computer. SMS has also been a big feature for us, especially with these lobbies being eliminated, basically, where you can be either in a lobby, in your car at home, or sitting on your couch. You can get a message that it's your turn, five people away, or just hey, welcome to the crew, and definitely have acknowledgement that you have entered into that queuing system.
Yeah, absolutely. And Nick, I mean, you spend your days looking at the healthcare space and how to better organize people in their and these hospitals. I'm wondering, and maybe it's even too early to tell, but do you think this will have a significant long-term impact? What's going on right now? People aware of keeping distance with people and just generally paying attention more to organization in lobbies, things like that. What kind of long-term impact do you think the coronavirus situation will have on, like I said, queuing and these technological advancements?
Yeah, absolutely. I think this is going to be something that kind of changes the aspect of what we do on a daily basis.
Mm-hmm.
From standing in lines to being in a crowded lobby space. I think there's going to be a lot of eliminations of it, and using technology is going to be the key factor for this. And so, as we go forward and we make adjustments into our daily lives, we're going to have to rely on our technological advances to provide for us how we communicate with each other mostly. And so, we're even doing things like online consultations instead of having one-on-one time with a doctor that you have to wait in the lobby to see. Well, it's going to be definitely be seen in the future that we do online consultations more and more
Mm-hmm.
as we go forward, I believe.
Yeah, it's really interesting. And I mean, Nemo Q, you serve a bunch of different industries. Did you feel going into this whole situation that the healthcare space was maybe ahead of the curve because they naturally do have to consider the privacy, the space, the distance between two potentially sick people? Or do you think the healthcare space maybe was behind in any sense in terms of the chaos that can ensue in a lobby or a waiting room?
Absolutely. So I think both and in some aspects
Yeah.
they're definitely ahead of the curve. Separating people with visible illnesses,
Mm-hmm.
whether that be hey you have a fever, you definitely need to be someplace else, or even triaging people based on the needs that need to be met immediately. So they've always been a little bit ahead of the curve on that aspect of
Right.
it. But the lobby sizes, the things like that, where you definitely just have an overflow system, and that's not necessarily on the healthcare industry as a whole. Well, what that really speaks to is that people are in need, and those healthcare facilities are definitely always going to be in use and always going to be someplace we have to go to see skilled
Sure.
professionals.
And I was hoping, lastly, if you could leave us and really the audience with maybe some advice here. I'm sure there are people that are managers at hospitals that maybe they're overwhelmed right now with what's going on, the influx of people that are coming into their lobbies. What is maybe one piece of advice or something you could say to them to sort of get a better grip on everything that's going on?
Sure. I think the key here is get help. You know, I don't diagnose myself because I'm not a doctor.
Right.
I don't treat myself because I'm not a nurse. This is what I do. I help people manage their lobby systems. This is what we do on a daily basis. So yeah, you can think outside the box and get some solutions there. But we've already have some built in for you that could definitely make life easier on your day to day without having to rearrange your whole lives, having to redo everything that you're doing on a daily basis. We can smooth it out for you. So definitely get help and seek the right people that are experts in their field.
Yeah, certainly. It's very well said. And I think we're all thankful that companies like NemoQ are out there addressing these challenges on behalf of these hospitals and doctors that have obviously their own issues to be worrying about now, maybe more than ever. But Nick, thanks so much for joining us here today. And we appreciate your time.
Well, thanks for having me, Jeff. Appreciate it.
Anytime.